Our hosts today are doctors of chiropractic, Dr. Gerald Bala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practicing.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Good to have you with us again today. Today we're going to talk about nutrient depleting drugs. We're going to talk about prescription drugs as well as over-the-counter medications. This is not an anti-drug program. Even though we're doctors of chiropractic, we are not anti-drug. We believe that God uses drugs and that there are many good drugs that save people's lives, but there are also adverse reactions to drugs. And because we are nutritionally oriented chiropractors, we have to look then at what are the nutrient depletion effects of drugs of patients that are coming in to see us. And that becomes very, very important. So what are, in North America, the most drug-prescribed country in the world, 46% of all Americans are taking drugs, at least one per day. Also, drugs in America are the most expensive. If you went to Europe, you would never be paying retail cost. You would never be paying the markup that our Congress allows the drug companies to get away with in this country. 21% of those age 65 or older take 5 or more drugs a day. I want to say that once more. 21% of those age 65 or older are taking 5 or more drugs per day. 25% of those people take 3 to 4 drugs per day. 36% take 1 to 2 drugs per day, and 18% of that age group is taking no drugs. Wow. No wonder these insurance companies got this drug bill through. It sounded really good, but the only thing that really happened when they got a drug bill through here some years ago is it allowed the drug companies and the insurance companies to charge more for the drugs. That's what it did. Okay, so in addition to the potential adverse effects and financial costs of being dependent on drugs, they deplete the body of vital nutrients. So now we're going to look at some drugs here. Don't want you to stop taking these drugs. Your medical doctor is not bad for prescribing them. She or he is doing the best job that they've been educated to do. Are they going to think much about nutrition? Not really. They're going to think about drugs. That's what they've been educated to do. So laxatives. A person that's taking laxatives is predisposed to having vitamin A, vitamin D, vitamin E, and calcium deficiencies. I'll say that again. People who take laxatives are predisposed to having vitamin A, vitamin D, vitamin E, and calcium deficiency. Now, people who are on antibiotics, they are predisposed to having deficiencies of vitamin B1, biotin, vitamin C, vitamin K, the mineral magnesium, vitamin B2, pantothenic acid, vitamin E, potassium, and zinc. Now, how about cholesterol-lowering drugs, the statin drugs? Cholesterol-lowering drugs, those who are taking the various cholesterol-lowering drugs are predisposed to deficiencies of vitamin A, beta-carotene, vitamin D, vitamin K, vitamin B12, folic acid, vitamin E, and iron. Now, the folks who are taking gout drugs that are to deal with gout or painful joints, they are predisposed to having deficiencies of vitamin A, vitamin D, vitamin B12, folic acid, and iron. These are serious things. We all need these vitamins that we are talking about if we're going to have reasonably good health. Now, those who are taking prednisone, corticosteroid type drugs, they're going to be predisposed to deficiencies of folic acid, vitamin D, the mineral or electrolyte zinc, the electrolyte, magnesium, vitamin C, and the most important mineral in the body, calcium. Now, how about the non-steroidal anti-inflammatory drugs? Dr. Jensen is going to address the possible nutritional deficiency related to taking those medications.
Thank you, Dr. Lala. Some of those deficiencies from taking these non-steroidal anti-inflammatory drugs would be folic acid, vitamin C, vitamin K, and iron again. So some of the things that we might find is a little fatigue coming in there due to the lack of iron for its oxygen binding capacity, as well as vitamin C. You start to see some weaknesses in the skin that may be coming from that, and some problems in methylation, which can bring up like heart problems. How about antacids? Antacids, you may have deficiencies in vitamin A, vitamin B1, folic acid, vitamin B12, chromium, and iron. So when we're looking at things like the chromium, we're looking at being able to handle our blood sugars correctly. That can result from some of those deficiencies, as well as adding to making our homocysteine is usually treated through folic acid and vitamin B12, and so you might have buildup of another heart risk from taking the antacids. How about oral contraceptives? Oral contraceptives you might find will deplete the system in beta carotene, in vitamins B6, B12, pantothenic acid, magnesium, vitamins B1, folic acid, biotin, vitamin C, and zinc. So you might find some of those nutrients are very important for our immune function, and might find yourself more susceptible to colds for that. How about sedatives and barbiturates? Vitamin B2, vitamin C, vitamin D. So you're looking for, vitamin D is very important for calcium absorption and for osteoporosis, that kind of thing. Folic acid and vitamin B12, again, you're putting yourself at heart risk. If for long-term, staying long-term on these vitamins, okay? I mean, on these drugs. Pantothenic acid can also carry with it other types of risks. So these are vitamins that are, they're vital because they're vitamins. That's what the name comes from. So then let's look at estrogen replacement therapy. Estrogen replacement therapy may cause deficiencies in vitamin B1, folic acid, biotin, vitamin C, vitamin B2, vitamin B12, pantothenic acid, and magnesium. And what it rings to me is sometimes you might look at muscle weakness that might result from some things like that, from these particular vitamin deficiencies, among other things. How about antidepressants? Many of the antidepressants that we take will deplete the system, or usually it's where your body needs more of these vitamins, or sometimes they'll block their absorption within the intestinal tract. We're looking at vitamins B2, B6, calcium, magnesium, and coenzyme Q10. And so when you're looking at these, at this particular set of vitamins, one is you're looking for bone health for one. Two, you're looking at energy in your system to create things with the coenzyme Q10. That's also a huge antioxidant. So many people on antidepressants might look at supplementing themselves with these types of vitamins, just to get past some of the deleterious effects of taking them for long term. Amphetamine and amphetamines, basically, they reduce B-complex vitamins in your system, the absorption of them. Many anticonvulsant drugs would also deplete the system of such vitamins as folic acid, biotin, vitamin D, vitamin E, and as well as zinc. So these are a lot of your fat-soluble vitamins, as well as some that are used a great deal for immunity and your nervous system. Dr. Lala, how about digoxin?
Digoxin is a digitalis type of drug. And those people taking that drug have vitamin B1 deficiencies. It's no doubt about that. Actually, it is estimated that 40% of all the prescriptions that are written in the United States of America are never filled by people. Another fact is that that the federal government in television and print advertisement requires that if they're going to advertise a drug, that they have to put on the potential positive values of the drug as well as the potential adverse effects of the drug. And you see that, but usually the print is so small that you need a magnifying glass to read it. Secondly is now if a drug company advertises a drug on the internet and does not give its commercial name, they do not have to, by law, they do not have to list the adverse effects. So wherever there's a law, people are going to find a way to break it, and wherever there's money involved, they're going to find lots of ways to break it. You cannot blame people for not wanting to take drugs unless they're close to death or they're going to have to recover when they begin to look at the adverse effects. And in our case, whenever a patient comes in, and many of them do, they're already taking drugs. Many of them know little to nothing about the potential adverse effects. So we, in performing due diligence, not to be anti-drug, because Dr. Jensen and I are not anti-drug chiropractors. We are not in any way that form of a chiropractor. But we download that information off the internet that gives them the full discussion of the drug, just not partial. Secondly is, even though many of the drugstores are putting a little piece of paper inside with the prescription, and it does list some of the potential effects and some of the adverse effects. What I've noticed over the past few years is the listing of the adverse effects is becoming a lot less, much more minimal than it had been. So they can see that people are afraid of taking the drugs because of the potential adverse effects. And this is easy enough for you to do. They're listing the website there. You can go out and look at any program you want, and this information is there, and it is science-based. It's not some voodoo nutrition. Now, what about diuretics? Do they have any adverse effects on our vitamins and minerals? They certainly do. They deplete the body and diminish the body of B1, of calcium. There it again, the most important mineral, electrolyte to the human being. Potassium, thiazide drugs especially, throw out potassium out of the body. Magnesium and zinc. So they not only excrete those minerals and vitamins, but they prevent the absorption of them. So that's what these drugs are doing, is they're preventing the absorption of those vitamins and minerals. Therefore, they're not going to be able to have them for proper health. Now, some of the angiotensin converting enzyme or inhibitor drugs used for high blood pressure and they are associated with zinc depletion. Zinc depletion is so important for not only healing and immunity, but healing of wounds and injuries, right? Just so important.
Exactly. And what do they tell people to take zinc for prostate?
Right.
And so you're looking at these gentlemen that have been on high blood pressure medication for just years, and it's a lifetime kind of thing.
And all of a sudden they're starting to run positive PSA, see? So beta blockers, what about the beta blockers? They're used very commonly today. Used in the treatment, again, of high blood pressure, are associated with the depletion of coenzyme Q10, a very, very important ingredient. The statin drugs, such as Lipitor, and we're not knocking Lipitor, any drug in particular, used in the treatment of high cholesterol, are associated with the depletion of coenzyme Q10 again. Yes, doctor?
This gives us an interesting argument in that here you have a drug that is meant to help for heart health by reducing cholesterol. And the way that it does that is that it inhibits a certain enzyme within the liver that creates cholesterol. We create 80% of our cholesterol in our liver, okay? It's just because the body says, hey, I need cholesterol, and therefore gets it. One of the reasons that it needs cholesterol is usually things like dehydration. Dehydration, it uses cholesterol for a scaffolding for the cell when it doesn't have enough water to hold its structure. So we increase the cholesterol in our body in relation to not getting enough liquid in. But then the other thing is, the flip side of that is, this enzyme that creates the cholesterol is the same enzyme that creates coenzyme Q10. And coenzyme Q10, as we lead down this path, is a bucket used to take care of antioxidants. So let's look at why I'm going down this trail. A heart attack, they're finding that the initial event that spurs on a heart attack is, say it's Monday morning. Most heart attacks take place on Mondays. First day back to work. Stress hits them. They have an emotional reaction, which then constricts the blood vessels. The constriction of the blood vessel holds back the blood, a little bit more. And what happens is it starts, because of all the emotions and things that are in there, it increases the free radicals in there, the oxidation type chemicals that are free radicals. And when those blood vessels then dilate again, let this blood perfuse into the tissue, the heart tissue, it contains all these free radicals. These free radicals are highly reactive due to their electrical properties. And it puts the heart, which generates this electrical signal, by the way, it puts the heart into fibrillation. And that fibrillation is the beginning of a heart attack. So basically, sometimes when you're taking these drugs, it depletes a certain enzyme that would keep you from having the heart attack, though you're trying to keep from having the heart attack in the first place by treating the cholesterol level. So in which case, if you're going to remain on this drug, it would be prudent for you to also supplement yourself with the correct amount of the coenzyme Q10, and to find that correct amount, you should have it monitored or measured to see how much you need. Okay, so end of lecture on that. Dr. Lala?
And of course, we take this information from resources. We have 3 pages of resources here where this is derived from. Let's talk a little bit more now about hospital-related injuries and also about, are vitamins and drugs fake, or are they real? It is estimated that there are more than 96,000 deaths that occur due to mistakes in the administration and infections contacted or contracted while in hospital. Out of the future now, out of every 20 patients admitted to any hospital, it is estimated that 1 out of every 20 of those people are going to acquire a hospital-related infection. Hospital-related infections are the 4th leading cause of death in America. They're higher than diabetes, they're higher than Alzheimer's disease, they're higher than people who sustain injuries in motor vehicle accidents. Now there's we're going to talk a lot about nutrition because, you can beat on drugs all day and all night, but a lot of nutrition is really fake nutrition, it's fantasy nutrition, it is really voodoo nutrition because there's so little regulation of it, any Tom, Dick, and Harry is going to get involved in it. So there's fantasy nutrition, there's philosophical nutrition, which involves the philosophy that sounds good, but it has either been unproven to be unscientific or not even tested prior to making the claims of garnering health.
Let me bring this in front of you. There is so many times in society today, in marketing, we find that repetition is a valid argument. So that means, if you see a commercial many, many, many times over, it becomes a valid argument to you, and you hear people quoting these commercials to each other and so forth now. And it really gets inside of you from the point that, how do you spell relief? If you spelled it with not the actual word, but something else, a product from years ago, you know how much this gets ingrained into you, okay? And so when we look at that, there are some products that are out there that we find, there's a sweetener that's out there that we find is, it's made from a natural source, but it's still processed. And we find that it's just very deleterious towards people who are fighting glycation problems. In fact, it surfaced as it was made. They're thinking about the same time that we started really having problems with glycation. And now I see they're having commercials on. They're saying that this stuff is good for you because it's from a natural source. And they're using that repetition as a valid argument and not necessarily following it up with good scientific data.
So, as I was saying, we're not going to just spend a little time on drugs, but also about voodoo nutrition. So that's called fantasy nutrition. It's voodoo nutrition. It's probably the major nutrition that goes on in the United States right now. There's also, as I said, philosophical nutrition. Then the one that I was going to start discussing is self-validating opinions. This means that people go around making claims that are self-validating claims, not scientifically proven, or they'll have some anecdotal information out there, some testimony of somebody out there that they were cured of cancer, they were cured of this or that, fibromyalgia, arthritis, or osteopenia, and they're just not proven.
Case in point, to argue this, calcium. There were commercials that were going on about this particular calcium, and that it was that it was shown to reduce cancers, to solve cancers. Well, the problem is that yes, it was shown in one type of cancer to actually bring it back to regular cancers, and that was the cholesterol that wasn't being absorbed, that was passing the rest of the way through the intestinal tract. And that was actually changing some of the precancerous cells back in the regular cells.
And that layperson out of Arizona who was selling that and promoting it and got it spread all across the United States, throughout the world, it took the FDA 4 years to catch up with him. So billions of dollars were generated out of people's pockets, and they thought, and they were having these testimonies, but they were unproven scientific claims. So it then comes to a question that we say that there's no due diligence. It's a legal term that means this: those who are making self-promoting claims but have not performed due diligence. We're trying to do due diligence in everything that we do. We're not the kind of chiropractic or health clinic that you want to go to that somebody's just going to get a crack in the neck and walk out the door. We want to look at that person as a whole person, not just for this temporary issue that they may be dealing with, but try to see if there's something that their body is telling us now that is predisposing them or could be predisposing them to health issues in the future. So there are a lot of then also dicey nutritional claims. Dicey nutritional claims. What does that mean? Making claims that their product will do this or that, or implying without saying cure, because the only time the federal government is really going to get down on these people is when these vitamin manufacturer, people selling vitamins, chiropractors, nutritionists, self-promoting people selling vitamins, is when they start implying cure. And a lot of those things are said, but they don't write them. And some people are very ill, and they're going to reach out to anything that will save their life, and you can't blame them. I don't blame them, but what it does often is it prevents them from getting proper medical treatment and or proper nutritional treatment. So now let's look then about prescribing based on symptoms. A lot of people in the health industry that are embracing the so-called wellness philosophy are basing treatment on symptoms alone. Symptoms are an alarm, a signal of something going wrong, but they are not necessarily, we have to find the cause if we're going to truly treat it correctly and make some positive progress. So again, symptoms are the final alarm. And we could also say this, that the absence of symptoms does not necessarily indicate the internal presence of wellness. Then, of course, there's surgical incompetence, such as removing a thyroid instead of the parathyroid, removing the wrong arm or leg, and now research shows that arthroscopic knee surgery with people who had arthritis isn't any more effective than it is that people who have regular exercise and nutritional care. Also then, Dr. Jensen has a thing about misreading x-rays.
Certainly there's a lot of false positives and as well as the other way that it's actually negative when that false positives, meaning that it's positive when it's actually negative, and sometimes it shows negative when it's positive, such as in many times there's mammograms that have been misread. Failure to x-ray, I mean, that's even worse.
That's a big deal in chiropractic clinics.
Oh,
and
sure.
a lot of those x-rays aren't being read by radiologists.
Sure.
And a lot of stuff is missed.
And there's a lot of times where we get complaints from patients who come in, and they come in just to get x-rays because their chiropractor has
Neglected to do it.
neglected or refused to
Or
do
is
it.
working for some HMO that wouldn't authorize the x-rays.
Right, right. And so when they don't do that, then they have to guess what's going on. And so that's a huge problem with that. Failure to send films out for a second opinion, like you were referring to. I've said on other programs of this, I want to send my films out to a guy that, there's some things out there that I may only see once or twice in all the years that I practice. And these guys who read films from across the country are seeing on a weekly and sometimes even daily occurrence that they see it and recognize it and inform me so that due diligence comes back and helps me that I don't miss something. Also, though we've both received great education in the colleges on reading x-rays and continuing education every year.
The highest incidence of malpractice in chiropractic is failure to diagnose, and the reason that they failed to diagnose is they did not take an adequate case history. Secondly, they didn't x-ray, or they made inadequate x-rays, or thirdly, they made x-rays, they were poor quality, and they didn't send the films out to a radiologist for second opinion. And you're saying, well, I missed something now. Well, that missing something now may not show up for 6 months or a year. And you're the one who's going to suffer for it, because if they have malpractice insurance, you can figure they're going to walk. So continue then, doctor.
Okay, so then we have also the problem of little to no pre-diagnostic testing, where we find that prescribing drugs or food supplements with little to no diagnostic testing, they're looking at the symptoms and say, oh, you have this? Well, then they automatically make the jump to this particular diagnosis and give them the prescription for or suggestion of food supplements based on that. And so that can be a problem. They might also have questionable diagnostic tests using procedures that are not based on credible university-accepted science-based data. And so that some of it is highly subjective. Anecdotal, and so that's some problems with that. So then we want to look at when you are looking at tests that are accepted and credible, you're looking at classifications of that. Is it a clinic? Does the test show you that it's clinical, or is it homeostatic in that? And clinical was taken from people that when they're outside this range, they're having clinical symptoms. People who are at a homeostatic, which is a much finer range, is taken from a population of people that are very, very healthy. Dr. Lally, do you have some closing statements on this?
I do. We invite you to really look at Proverbs chapter 8, verses 10 through 11. Very, very important. Receive instruction and not silver, and knowledge rather than choice gold. For wisdom is better than rubies, and all the things one may desire cannot be compared with her. Look, if you don't know Jesus as your Savior, we'd invite you to welcome Him into your heart. It's just a thing of believing, of accepting Him, and He'll come in. Do look then at Him as a gracious God, as a great physician, and you'll find health and healing in and through Him. You really will.